Hey, good afternoon, Nighthawk Nation. Dr. H back for Chapter 2 for the summer semester. It also runs with Module 2. And we'll be discussing the current operations of the U.S. healthcare system. And we're going to kind of piggyback off a little bit from Module 1. And you'll find that every module, every week, will build upon the prior week. So it won't all be foreign to you. Some of the learning objectives for Module 2 that you should walk away from, you should be able to identify the stakeholders within the U.S. healthcare system and how the relationships correspond with each other, how they work together. You should be able to identify at least 3 global healthcare statistics and the impact they have on the health status of various countries. In Module 2, you'll also be assigned a country and you'll begin your comparative health project. You'll want to be able to discuss the impact of the pandemic on healthcare services and how it changed the way we approach healthcare services. And then, last but not least, analyze the global COVID-19 vaccination efforts in OECD countries. We'll look at the effectiveness and how it varied from country to country. Some of the things that we want to look at is we want to look at the stakeholders' perspectives. One of the principles of the U.S. healthcare system is duty to treat. And this means that every person deserves basic health care. And remember last week, we talked a little bit about social injustice. And this is where we are working to overcome that. Also, in order to provide healthcare services, there are several stakeholders, and we'll discuss here in a moment exactly who those stakeholders are and what a stakeholder is. They're interested entities that participate in the industry. And from an organizational perspective, we're going to look at the consumer as the most important stakeholder for an organization, and this is something that you're definitely going to want to make note of. So who are the stakeholders? Patients or consumers, they are the number one stakeholder. The reason that the healthcare industry exists is because of the patients. Next, we look at the employers, and this is going to be both private and public employers. This is going to be hospitals, long-term care facilities, clinics, what have you. Some of those entities can also be known as stakeholders, such as hospitals, nursing and residential care facilities, long-term care facilities, physicians, practitioners, home health care services, outpatient, and ambulatory health care services. This is can be urgent care, it can be the doctor's office, it can be the hospital, a surgical clinic, an orthopedist. And so there's various number of stakeholders here, but the number one stakeholder, whenever we refer to the stakeholder or consumer, is the patient. And the patient is far and above number one when it comes to stakeholders. Some of the other stakeholders we'll see, laboratories such as urinalysis, blood work, things of that nature. Educational and training organizations, that can go all the way up to universities, to technical schools, to CAHIMs. There's a number of organizations, research organizations, the National Institute of Health, the CDC. There's any number. We also have professional associations, the American Medical Association, the American Nursing Association, and then probably the one that we hear about the most right now anyway would be pharmaceutical companies. And this is pharmaceutical companies provide the medicines, they drive the demand, unfortunately, at times. But the pharmaceutical companies are a major stakeholder. So after you finish Module 1 and Module 2, you should be able to identify the role of these stakeholders and know what role they play in healthcare. Also, in this module, we're going to look at the importance of statistics. And we use statistics as a way to calculate or to assess healthcare services in the United States. We know, just as an example, we look at cancer rates in the state of Georgia, and we look at smoking rates in the state of Georgia, and we look at how those correspond or correlate. When you look at South Georgia, you have a higher smoking rate than you do in North Georgia. North Georgia is below the national average. Southern part of Georgia is above the national average. We also see a higher per capita, a higher rate of cancer in the southern portion of the state. So these are things that statistics can be used to look at. The National Center for Health Statistics, which is run by the CDC, produces annual reports on health of the nation, and you can go in and look at this. It's very transparent. You can look at what diseases are driving healthcare and down to a city within the county. We can look at health ratings of counties with this report. It's an outstanding report. Now, if you're in the healthcare industry or plan to be long term, I would get to know this report and learn it. We look at life expectancy rates, which are calculated to assess the health of the nation. Right now, we've had a slight slide in life expectancy for the first time since the Great Depression. A lot of this can be contributed to the opiate and the pandemics and the opiate situation we had going on. I think we'll start to see this rise again, as we know that centenarians are one of the fastest growing populations. So I expect to see that rate rise again. And then infant mortality rates are also calculated to assess the health of the nation. And this is actually something you can find in the report released by the CDC annually. Some of the additional items that we want to look at is, data are a numeric representation of health issues. And when we are able to pull these large amounts of data when it comes to healthcare and health issues, we're able to do comparisons such as what we discussed in the prior slide, smoking rates or tobacco use in northern part of Georgia compared to the southern part of Georgia. And when we talk about North and South Georgia, from a medical standpoint, everything south of Atlanta, everything north of Atlanta, basically. And then we can look at data to tell us what healthcare problems there are. And this allows us to make decisions and prioritize strategies to address certain healthcare problems. And we can do that down to a local level. So, if there's a county such as Lumpkin County, just as an example, maybe they have a higher type 2 diabetes rate than Forsyth County. Lumpkin County can start looking at programs to address type 2 diabetes. Maybe there's another county where Dawson County, where there's a uptick in migraines. So they can start putting strategies into place to help and find why migraines are taking place and what we can do to help with that. And so these are just examples. The International Healthcare Statistics, it was established in 1961. It was an organization for economic cooperation and development. It monitors the trends of economic development as well as healthcare within countries. Currently, there are 38 countries, including the United States, that partner in this organization, where we freely exchange data and discuss healthcare and economic trends. And so the importance of the exchange of this data cannot be underestimated, as we saw with the pandemic. And speaking of the pandemic, we were able to look at, during the pandemic, the mental health impact. And so we had a lot of isolation take place. And we know that when people become isolated, we start seeing a rise in comorbidities, illnesses, loneliness. And so we were able to actually do studies on a large scale. In 2020, a survey of the Italian healthcare workers who worked directly with patients, which was nearly 50%, exhibited symptoms of PTSD. We saw similar rates, not quite as high here in the U.S. 62% of the frontline health workers reported that stress and worry impacted their mental health and their physical health, but the PTSD rates were not quite as high here in the U.S. And we have a different system, and so for whoever draws Italy, that might be something to look at. So additionally, we also looked at anxiety and depression in 2020 with the pandemic. Several countries, mainly the US and the UK, were the front runners in these studies. France came along a little bit late in the game, but they also participated. We saw that there was a peak in disease levels We saw a increase in anxiety and depression during the pandemic, and so we were able to begin looking at different methods to deliver healthcare in mental health care due to the pandemic and some of the things we saw. One of the surveys indicated that people of higher socioeconomic status reported higher levels of dissatisfaction and increases in depression than those of lower SES status. And part of this could be because that SES status results in more disposable income, which people were not allowed to use because of the pandemic. So people that were in higher SES were used to going out, doing things, spending money, and all of a sudden they were having to stay home. And a lot of people that are in a lower socioeconomic status were already at home and were already taking advantage of the opportunities, the things that they had around them already, and the social networks that they had developed at home, whereas people in higher socioeconomic statuses weren't doing that. And so that was a very interesting study and a very significant find that we came about. A positive impact of the pandemic is telehealth services skyrocketed, and it hasn't stopped since the pandemic. We are seeing still an uptick in telehealth. We find that quality healthcare can still be provided at a faster rate, lower waiting times. And so across 22 of the OECD countries, 45% of adults received a medical consultation by telephone or online. That's an incredible number. And we're seeing these numbers still stay pretty high. A negative, of course, the use of the telehealth, older patients were more reluctant to use this. They were more inclined to have that social interaction, that physical touch by the actual doctor, and they didn't want to have to use their iPads. Now, where we see the cutoff on this is what we're talking about is individuals at the age of 75 and older were very reluctant in using that. We didn't really see that reluctance in this under the age of 75 quite as much. And so the conclusion that at the end of this, we know that data is very important, and it provides an opportunity to compare health behavior and results. And when you do your health comparison project, you'll use data to look at these comparisons. It's also important to compare the United States with other countries, and that's why we are doing this project. And I think you're going to find that we are the most expensive healthcare system in the world. Should we be the healthiest? And part of the reason is we have what's called a proactive system, as whereas the rest of the world, or a majority of the world, has a preventive system. And we'll discuss that later on in the semester. Basically, in a nutshell, a lot of countries require that their patients, their consumers, their stakeholders receive medical care annually, whether it's a checkup, a physical, lab work. And so they're catching illnesses and disease early on. As where in the United States, typically we don't go to the doctor until we're feeling ill. And so that, along with the pharmaceutical expenses in the U.S., these are some of the reasons that it is the most expensive healthcare system in the world. And like I said, we'll discuss this more in detail later on. Other than that, I don't have anything else for you for this day. I hope everybody's having a wonderful and fantastic semester. And other than that, I don't have anything else for you. Stay strong, Nighthawk Nation. Dr. H out.